Hello, I'm meteorologist Don Lures, and thank you for joining us for this edition of Weather Awareness. Well, finally, the year 2020 is in the rearview mirror. We're looking ahead to a brand new year. 2021 is here, and hopefully it'll be a good year for everybody. Right now, we're kind of looking back at hurricane season in 2020, and boy, it was a busy one. James Carnes is with us right now. James, of course, with AMS Tree Service, and I guess if there's one industry that really watches hurricanes carefully and tries to map out where they're going to go and what they're going to do, it must be folks that are in the tree business, especially clearing up after a big storm.
Yes, sir. It keeps us busy.
It does. Now, in 2020, you had 30 named storms out there, all dancing around throughout the hurricane season, and people tracking each one, wondering if they were coming. All said and done, though, we got off relatively easy around here.
Yeah, it wasn't too bad. A lot of people staying prepared more now.
Yeah, that's one of the things that we try to stress. I know we had you on in the beginning of hurricane season talking about the value of kind of surveying your property, making sure any problem trees were taken down ahead of time, and kind of just grooming your yard so if a hurricane did come, you could minimize your damage. And that's worthwhile doing every year because that changes, I guess, over time. Even if you're in the same property, next year you might want to revisit that same thing, right?
Yes, I always keep an eye on the low hanging limbs, roots that you see them starting to come out of the ground. You always want to keep an eye on that. It's potential trouble.
Exactly. Just cosmetically, again, you can just kind of, lift the tree up a little bit, make it look better, because they're always getting a little bit out of control if you let them go too long. Yeah. But we're out of hurricane season now, of course, and we're right in the midst of winter. That means ice storms are another concern that folks have around here for tree damage. And I was looking back over the years historically, and boy, some of those ice storms were just devastating around here as far as tree damage goes. Talk a little bit about your history with that.
Yeah, the ice is more trouble than anything sometimes. It'll get on them trees, it pulls your limbs down, and then you got snapping. Your sidewalks, that's even with your limbs hanging over your sidewalks. It keeps it shaded, the sun can't dry it up, and that's an easy slip. But always watch for that. Even your power lines coming into your house is hanging. The ice will just hang there, and it's just bringing weight to it. Exactly
right. That water weighs a lot. If you think about just how heavy a bucket of water is when you try to lift it around, that's the weight that's on those trees. And if you get ice, anything over about a half an inch really starts to weigh down, and you can bring a lot of branches down, limbs down, even whole trees down.
Yes, sir.
It seems like those pine needles especially really gather up that weight of the ice. The pine trees, the branches just come snapping. Right. I remember it's kind of even a more eerie situation than a hurricane, because a hurricane, you hear the wind roar and there's lots of noise, but with the ice storms, it's real quiet, except when the tree finally breaks, you hear that loud snap and it comes crashing to the ground.
That's kind of waiting to happen.
Kind of an odd situation like that. Just like with hurricane season, you can do the prep work ahead of time, kind of survey your yard and see what might be a problem. You can do the exact same thing now that we're in winter with the ice storms, right?
Right. Always check your limbs. If they too far down, anything covered areas where you're going to be walking, if you got limbs coming down, when that ice gets on it, it could fall anytime.
Yeah, one thing that I remember you told me in the past, just kind of look around and see where you wouldn't want your car parked under.
Right.
If you don't want to park your car under it because you're afraid it would fall on it, you probably need to do something to try to fix that ahead of time, right?
Yep. Car, anything you got parked in the yard, anywhere you're going to be walking, anything of potential danger.
Very good. Now, let's say that we do end up having an ice storm and people are just kind of trapped in their house more or less because limbs are down everywhere, trees are down. It's kind of dangerous to go out there and try to do it yourself, right?
Yes, it's best to call somebody.
Yeah, I've read stories where post-storm of a hurricane or post-storm of ice storm, a lot of the injuries aren't during the storm, they're after the storm.
That's right.
With folks inexperienced with what they're doing, and that chainsaw kicks back at them, and all of a sudden they're hurt, and they're still in a mess with the trees all everywhere, and now they just got two problems. What would happen if an ice storm comes? How quickly would AMS Tree Service be out there to help somebody?
As soon as they give us a call, we can either send somebody out there to assess what all you got, or we can schedule a date when you want to get out there and get it done.
Very good. And as far as the prep work, if people want to kind of eyeball their property or even have you come out and survey their property and see what maybe needs to be done, that's as simple as a phone call too, right?
Yes, sir.
Very good. Well, AMS Tree Service does great work. They've been doing it for a long time. How many years have you been in the business?
I think we've been going about 9 years now.
Yeah, it's a good long while I've known you. So that's a lot of experience. How would folks get in touch with you to get some work done?
Call 843-610-9780.
One more time.
843-610-9780.
Well, very good. I hope we get by as easy as we did with the ice storm season, as we did with hurricane season.
Yes.
But it seems like we're always flipping from one to the next. As soon as we're done spring, we'll all be looking ahead toward next hurricane season.
Yes, always something.
Never ends, right?
Yes, sir.
Very good. Well, I hope you had great holidays. I'm glad to see you here to kick off the new year, and Happy New Year.
Happy New Year. Good to be here.
Very good. James Carnes with AMS Tree Service. We'll be right back after this. If you are in the market for a car, truck, or SUV, you have to check out Parker's Used Cars. Parker's Used Cars is on Highway 38 South in Blenheim, located between Latta and Bennettsville. Tommy Parker, the owner, has built his reputation by selling high-quality vehicles for 29 years. You won't believe the selection. You'll have over 600 cars, trucks, and SUVs to pick from. Check them out online at parkersautos.com. That's parkersautos.com. Or call them at 843-528-3301. Parker's Used Cars in Blenheim, Highway 38. And welcome back to Weather Awareness. We were talking with James Carnes a moment ago about how happy we are to see a brand new year here, and certainly no more happy than anybody is the healthcare industry. Right now, Jay Pruitt with Agape Care is joining us. Agape Care, of course, the hospice company I work for, and Jay as well. Jay, I tell you what, health workers that we work with all across the state, be it doctors or hospitals or nursing facilities, they've had a rough year this past year.
Absolutely. Everyone says 2020 is gone and good. Keep it away. It's been a tough year.
Yeah, but we are in a brand new year now and happy to see it. But seriously, about the COVID situation that we had during this past year and still have a while more to get through before we're in the clear, things are looking up. Vaccines are out. Things are moving along toward the right direction now, but still it kind of rocked the healthcare industry where really no matter what field of health you're in, you did have big impacts.
Oh, absolutely. I mean, we thought we had turned the corner. We had flattened the curve, so to speak, wearing masks, hand washing, sanitizing as much as possible. But as folks came back together, you know, whether that be Thanksgiving, whether that be, you know, opening football stadiums back up, whatever, the numbers slowly started creeping back up. Unfortunately, it has really caused our senior population to suffer, you know, quite a bit.
Right. Within the hospice healthcare provider part of the industry, how has that impacted the patients we've seen? It seems like locally here in Dillon and Marion counties, I haven't seen a really strong impact with the hospice patient population, but it is something that we've seen a lot of in hospital setting, a lot of hospice patients. Talk a little bit about that.
Yeah, I mean, and you're right, Don. In the hospital setting is where we're seeing most of that, the increase in COVID-19 cases. Several floors in the hospital, probably 1 or 2 floors, are generally designated just for those COVID patients. We, on the hospice side, may or may not see those patients as a result of that diagnosis, but that's where we're seeing the biggest increase. We're seeing many of our physicians' offices, as you know, facilities that are restricting our access to them even more so than back in March when we first started this because of the rise, you know, in those cases.
Exactly right. And thankfully, though, the patients that we've had on our services living at home in their home environment, we've been able to keep them pretty protected and isolated from the virus. And that's really been one of the nice advantages of having the hospice team following the protocol so much.
Absolutely, and as you know, we have a ongoing, weekly, almost daily COVID emergency plan, which talks about our nurses, you know, wearing the proper PPE to make sure that our patients, their families, those caregivers stay safe. There are cases when people are exposed on our side of the fence, but I haven't seen too many of our patients, you know, become ill with COVID-19 based on, you know, being on hospice and our preparedness with the PPE.
Right, and another plus side of that whole equation is that by having hospice services in the home, we're able to keep them out of the facilities where there's so much COVID involved within the facility. So it's been a good situation from that respect. Over overall a situation we hope doesn't come along and
Right.
repeat itself anytime soon. But like we said, that hopefully will be behind us soon entirely, and the year 2020 already is. We'll come right back and talk about hospice in general. How's
Sure,
that?
absolutely.
Okay, we'll be right back after this. If you are in the market for a car, truck, or SUV, you have to check out Parker's Used Cars. Parker's Used Cars is on Highway 38 South in Blenheim, located between Latta and Bennettsville. Tommy Parker, the owner, has built his reputation by selling high-quality vehicles for 29 years. You won't believe the selection. You'll have over 600 cars, trucks, and SUVs to pick from. Check them out online at parkersautos.com. That's parkersautos.com. Or call them at 843-528-3301. Parker's Used Cars in Blenheim, Highway 38. And welcome back. Since Jay Pruitt is joining us with Agape Care, I thought I'd take a little moment or two to just talk about the benefits of hospice as well. I'm sure I've probably shared with you a time or two about the experiences within my own family of how important hospice was to get through a tough situation and make a terminal diagnosis with my dad, although it did not change so much better in terms of how he was able to handle it and get through it. He was on hospice for 8 months, Jay, and I think I've told you a few times before, the time of his period before hospice was very, very rough. The 8 months he was on hospice, so much better.
Right.
And it's just real inspiring to me to be able to know that in my heart and have that in my experience and go out and share it with folks, be it providers like physicians or nurse practitioners or hospitals, or with families that might be starting to face a situation they've never faced before. I'm sure you've kind of had the same experience.
Absolutely. I mean, just like you personally have had that experience. I enjoy listening to you tell your story out in the community about your dad and how he was on hospice for 8 months. And really that 8-month period is the key. Mm-hmm. It really is, because in times of crisis, we don't want to see our loved one, our friend, in and out of the hospital.
Right.
Having to continue to bounce back and forth.
That's exactly his situation. He was going back and forth to the ER, sometimes getting admitted, and it had picked up in frequency where it was just out of control, 2 and 3 times a month before he came on hospice. And that really affected his whole psyche. He was depressed, he was anxious, he was scared, miserable. He really was. Right. And once he got on hospice and they were able to so dramatically reduce that back and forth chaos, he had one more ER trip those whole 8 months. And you can just imagine how much better he felt.
Absolutely, and not to mention how you guys felt.
Exactly. My mom was the main caregiver, and it took a big weight off her shoulders.
Absolutely.
A lot of stress off her mind. It was very, very good.
It definitely is a beautiful thing. I tell people, as much as we speak to folks in the communities, in the healthcare communities, that hospice is a beautiful benefit when you need it. And we, as an industry, have to be really good and diligent about letting people know what that benefit is, and that it doesn't mean the last day of life or the last week. There's such a that 8-month period. That's the time that we really want our patients and caregivers to really experience. That time, before the end of their journey.
Yeah, let's talk a little bit about what that benefit is, because I kind of usually split it up when I'm talking to folks into two sides. One's the people side, and the other is the equipment and supply side. So on the people side, it starts with the nurse.
Absolutely.
It can be as simple as just that nurse coming by. For folks that don't want a lot of people coming into their home and feel overwhelmed, it could be as simple as a nurse coming by, being eyes and ears for their doctor once a week.
Absolutely. And then that CNA, that certified nursing assistant, to come in and help with those activities of daily living. They could be once a week, they could be 3 times a week, they could be none at all. But I smile when you mention the people side, because in those stories that we tell, mine with my mom, yours with your dad, I just remember that for my mom being the most important side.
Oh, absolutely. My dad literally told me that his hospice nurse was his best friend.
Right, absolutely.
I mean, that just blew me away. That was just awesome to hear. That bond got that tight between him and his hospice nurse. And the way he explained it to me when I said, really? He said, absolutely. He said, I was going through some struggles, and I was able to talk to her about some of the things I was worried about without having to feel like I was worrying everybody else.
Absolutely.
And it made a nice outlet for him.
Absolutely.
Now, some of the other folks are probably wondering about where their doctor fits into this. We work with all the local doctors in Marion and Dillon and Marlborough County as well from this office, and almost to a T, most of the doctors we work with like to remain involved in part of the attending care. So when people come into hospice, a lot of folks think they're going to lose their doctor,
Right.
but that's not usually the case.
Absolutely not.
In fact, it's never the case if the doctor's okay with it.
Absolutely. And that's one of the questions that you and I are asking when we're speaking to families and with the physicians is, how much involvement do you want to have with that ordering physician or with that patient? And 9 times out of 10, if not 100%, they're keeping that physician. That physician wants to continue to be part of that care. So it's a great thing. And they can absolutely do that. They lose no one.
That's right, and for most folks, that's the doctor they've known for years and years and years.
Right.
They have complete trust in, so we want to keep that trust and good feeling about that relationship and not break it. The other thing is, of course, we do have our own internal doctors working as medical directors for us, that if we could not reach their particular doctor, it's an emergency, we have a backup plan where we can just go to our medical director and get that.
Yeah, it's a team of folks that are working together for the good of that patient and that family. So if their medical director, our medical director needs to reach out to their physician, it's a great, smooth process.
Yeah, 2 other people on the people side we haven't talked about yet, if you could just touch real briefly. The social worker and the chaplain.
Absolutely. So the social worker, of course, Don, is that person that's going to try, the way I look at it is just kind of bring everything together, bring it all together. Maybe they have questions about what to do with life insurance, what, to do about, I need a ramp to help get mom or dad inside. That is the person with the resources. Within the community, outside of the community, they can touch other social workers within the state to find out if they can help meet those needs. So that's that person. I always tell folks that tell us that I don't need a social worker. You will. Just when you have questions. And they don't have to be related necessarily to the beginning of the hospice stay or the end of the hospice stay, just anything in between.
Right.
And then that chaplain. The chaplain is so very important, I think, personally, just because we're meeting patients where they are, spiritually. It doesn't, not necessarily a Christian viewpoint or whatever. It is somebody that is going to be right there where you are, where your family is, and where you need them to be is where they'll be. My mother was a Catholic. Her chaplain had no idea, about last rites and those type things.
Right.
But he did his homework. He called the Catholic Church locally in the Grand Strand. He was able to have the priest come and do those things that she needed done. So they're a very integral part. Many of our patients, they'll say, I already have a pastor, which is fine, absolutely, that visits them. But they're there. Those chaplains are there for phone calls, for visits, whatever they need, not only for the patient, but for the rest of that family.
Yeah, I've actually had some families that have a great relationship with their preacher or pastor, but like our chaplain to come by just to have a visit.
Absolutely.
They're kind of stuck in the house, not going out as much as they used to, and it's another friend drops
Or
by.
play a song.
Yeah.
Sometimes my mom's chaplain had a guitar. He'd come and play her song.
Yeah, a lot of times the chaplain will play a song or sing a hymn or something like that. Now on the equipment side and the supply side, that also can lift some of the weight off their shoulders.
Absolutely.
As far as worries about what happens if I need this, what happens if I need this. I'm exhausted going to the store all the time for the pull-ups or briefs, whatever, all those type of supplies you may need. They're part of the service too.
Absolutely. The medical equipment, absolutely. You may need a hospital bed, over-the-bed table, bedside toilet, any of those things, absolutely covered 100% as part of that Medicare benefit of hospice. Any of that, all of those things. And if later on down the road, when the nurse is not there, you realize, hey, I may need a walking cane or a wheelchair. Absolutely, we can order that and have that right there in the home for you.
Exactly. And the other thing you mentioned when you said the word Medicare on there, some folks hear all this and they say, that sounds great, but how could I ever afford that? Or how can I pay for that? Or how much does it cost? What I like to tell folks is, since most of the people we help are in their later years, is something you've paid for all your life. You've been paying those Medicare taxes, and the hospice benefit is a Medicare benefit that's
Absolutely.
totally paid for.
Yeah, and that's why I mention it that way. Many times when I'm speaking to families, or a physician, I speak about the Medicare benefit of hospice because it's truly that, a benefit, 100% paid for, by what they've put into the system all these years. So there will never be any, copay that's going to come, a bill in the back, because we get those questions because no one wants to pay, for anything that they shouldn't have to. And I totally get it. So Medicare has this allotment for hospice, and it's a beautiful thing. And not to have a bill on the backside is absolutely great. So that helps take that off of a family's mind in this time.
Very good. So hopefully by all the information we're sharing, some folks will realize that they do have options out there if they're facing a illness that's kind of beyond the curative part, where they do have curative aggressive care options, and now they're looking for just that, what can I do to make my quality of life as high as it can be? Let's just close by talking about that. What is the goal of hospice when they have a patient that comes into service?
Well, is to keep, the first of all, and is to make sure that we're keeping that patient comfortable. Depending on what diagnosis they have, that's the main thing. We don't want agitation. We don't want pain. We want the best quality of life possible.
Right.
So with all of those services that we spoke about, all of those disciplines that we spoke about earlier, that's what we're going to do. Medication-wise, answering questions, putting the family's mind at ease. So it's just a great, smooth process.
Right. Well, Jay, I hope you have a happy 2021.
Same to you, Don.
Very good to have a new year here and an old year behind us. And some people are saying, keep it back there.
Keep it behind me. I'm good.
That's right. Thank you, Jay.
Thank you.
Jay Pruitt with Agape Care. Thank you for joining us for this edition of Weather Awareness.